listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, staying compliant with every step of the sales and enrollment process can seem intimidating, but it's also important. Join us as we break down the requirements into bite-sized topics in what CMS requires agents to discuss prior to Medicare enrollments, written by Roxanne Anderson. Agents who sell Medicare Advantage and Part D must discuss specific CMS-required topics with beneficiaries prior to enrollment. We are going over that list of requirements so you can more easily stay compliant. Before enrolling a client in a Medicare Advantage or Part D prescription drug plan, agents need to discuss CMS-required questions and information on the 8 following topics. Medicare eligibility, primary care providers and specialists, prescription drug costs and coverage, specific healthcare needs and costs, premiums and cost sharing, plan benefits, effect of a Medicare coverage change, and administrative items. Next, we'll summarize these discussion topics and requirements. For a full list of questions and topics that must be discussed, visit the episode notes for the PDF of the CMS Agent and Broker Training and Testing Guidelines. Additionally, for all of CMS requirements, check out the references in the episode notes for links from the CMS website and the Federal Register. You can also download our comprehensive MA and PDP compliant sales checklist. All of those resources, again, will be linked in the episode notes. The first topic we'll cover is Medicare eligibility. Near the start of your conversation, you should check if your client has a basic understanding of their Medicare options, including Original Medicare and Medicare Advantage. Explain that to enroll in Medicare Advantage plans, individuals must be entitled to Medicare Part A, be enrolled in Medicare Part B, and continue to pay the Part B premium. Double-check that they're eligible for Medicare Advantage plans and if they qualify for a special needs plan, like a D-SNP or a C-SNP. Ensure your client understands when they can enroll in, disenroll from, and change Medicare plans at specific times of the year or in certain situations, like special enrollment periods when they move out of their plan's service area, when they qualify for Medicaid or extra help, or when they move into an institution, like a nursing home. Once they decide they want to enroll in a plan, go over the effective date of their coverage with them. If applicable, also discuss the Income-Related Monthly Adjustment Amount, or IRMA, for Part B and Part D, the Part B and Part D late enrollment penalty, the Public Assistance Program, private fee-for-service plan rules, and special needs plans' special eligibility requirements, including the disenrollment rules for members who no longer meet the requirements. Number 2, primary care providers and specialists. On the topic of providers, at minimum, you should ask the client which primary care providers and specialists they typically see or would like to see in the future. Then, let the client know if those individuals, practices, or facilities are in the plan's network. It's also important to ensure the client understands what in-network and out-of-network means and their coverage and costs. For example, stating something like, you must use plan providers except in emergencies, urgent care situations, or when out of area. If you obtain routine care from out-of-network providers, neither Medicare nor the plan will be responsible for the costs. If the client is interested in a preferred provider organization, or PPO plan, review both the in-network and out-of-network costs. Additionally, explain or show the beneficiary how to look up network providers. Number 3,
Medicare prescription drug coverage and costs. Many Medicare beneficiaries struggle with the high cost of prescription drugs. When discussing prescription drug coverage, you should ensure your clients understand how the plan impacts their medical needs, including whether their current prescriptions will be covered on a plan's formulary. Try showing a prescription drug cost comparison between different coverage options. You can also explain the different Part D coverage stages, including the Part D redesign updates, copays and coinsurance for their selected pharmacy, and the use of preferred pharmacists. You should make sure your clients understand how to use the pharmacy directory, step therapy, prior authorization, and quantity limitation. To prepare them for any future prescription needs, show clients how to find out if and how their prescription drugs will be covered via the formulary. Number 4, specific healthcare needs and costs. The cost of healthcare services keeps increasing, while many Medicare beneficiaries are on a fixed budget. It's important to ask your client what healthcare services they regularly use or may use in the future. Do they go to the gym? Do they visit a chiropractor? Visit urgent care when they're sick instead of a family doctor? Review how much their healthcare services would cost if they enrolled in a plan and how those costs may affect their budget. Make sure your client understands preventive care, emergency room visits, and urgently needed services. Do they have any specific health conditions they haven't already mentioned? Do they use or expect to use alternative medicine or any durable medical equipment? If they answer yes to any of these questions, that could affect whether a plan will or won't work for them. And don't forget, your client may not know or understand how their deductible, maximum out-of-pocket limit, or copays and coinsurance work. To understand the costs of healthcare services, it's vital your client understands these parts of coverage. For copays, be sure to touch on how they differ for in-network versus out-of-network providers, inpatient versus outpatient hospital stays, and specialists versus primary care providers. Number 5, premiums and cost sharing. Are your clients aware that even though they're enrolling in a Medicare Advantage plan, they'll still be responsible for paying for Medicare Part A if they don't meet the work requirements? Do they know about Part B premiums in addition to their Medicare Advantage premium? And when applicable, are they aware of their Part D premium? Do they know what a plan premium is? Hopefully they do, but you don't know unless you ask. Healthcare costs can be unpredictable from one month to the next, but your client should never really be surprised by their monthly Medicare premiums or any cost sharing, especially upon a new enrollment. Those are expenses they can budget for. Make sure to cover what premiums and cost sharing they'll be responsible for paying, including the specific dollar amounts or percentages. If their plan includes a Part B premium reduction or giveback, make sure they understand what that is and what they can expect back. Number 6, plan benefits. Medicare Advantage benefits can differ from one plan to the next. Your client should understand that they may not have the same benefits as their neighbor Janice or their brother Kevin just because they have a Medicare Advantage or Part D plan. Review the plan's benefits with your client and ensure that they understand how these benefits and the costs associated with said benefits would impact them. Don't forget to go over any potential limitations of their plan, such as their dental, vision, and hearing coverage. Number 7, effect of a Medicare coverage change. Explain the potential effect that enrolling in this plan will have on current coverage. In some cases, electing new coverage may mean that the individual is disenrolled from current coverage. For example, another Medicare Advantage plan or a Medicare supplement plan. Make sure the beneficiary understands what will happen and the effects of losing that coverage. It's also important to discuss the effective date of the new plan and when the beneficiary can expect current coverage to no longer be in effect. Number 8, administrative items. There are a few additional, more administrative items you must always discuss with beneficiaries that aren't necessarily discussion topics we previously mentioned. For instance, if you're holding the appointment remotely, you must disclose call recording and state the third-party marketing organization disclaimer within the first minute of the call. In person or remote, ensure the beneficiary understands that you are not a representative of Medicare or the government. Additionally, it's good practice to identify the products to be discussed at the start of any appointment. Remember, you can only discuss products documented in the scope of appointment, which must be collected 48 hours prior to the meeting. There are 2 acceptable exceptions to the 48-hour waiting period. 1, if a beneficiary is 4 days or less from the end of a valid enrollment period, or 2, the beneficiary initiated an unscheduled in-person meeting. If the beneficiary requests to discuss additional products, you must obtain a new SOA or schedule a new appointment, depending on the additional products they're interested in. Another reminder on CMS Medicare Advantage enrollment regulations surrounding SOAs. You can't ever discuss certain product types during Medicare sales appointments, including annuities and life insurance. Cross-sell these plans during separate meetings. Other items you should discuss during appointments include the overall star ratings for the plans discussed and where the beneficiary can find them. Let beneficiaries know how to file a complaint with Medicare and the applicable health plan, too. You will also need to cover the evidence of coverage and Medicare pre-enrollment checklist. The pre-enrollment checklist is a standardized piece that aims to help enrollees understand important plan benefits and rules. You may find it included with the summary of benefits as part of the carrier's enrollment kit. The CMS pre-enrollment checklist is an essential resource for agents to utilize because it ensures you've covered all CMS-required topics. If it's not incorporated with carrier materials, you can view it in the CMS Medicare Communications and Marketing Guidelines, which will be linked in the episode notes. At first glance, we know Medicare Advantage and CMS requirements can seem intimidating, but hopefully after listening to this episode, you won't feel that way. Remember, each of these topics involves factors that allow you to make the best plan recommendation possible. As long as you're truly selling with your client's best interests at heart, these requirements are more akin to best sales practices put to paper. Also important to remember, you are not alone. If you have questions about the requirements or anything industry related, don't hesitate to reach out to us here at Ritter Insurance Marketing. You can send us an email at asgpodcast@ritterim.com, and we will be happy to work with you. Thanks for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson, script adaptation by Tina Lamoureux, recording and production by me, Sarah Ruppel, podcast design by Urban Rivera. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.